Hi, everyone. My name is Emily Hassan, and I will be utilizing this time to discuss Dr. Carrie S.W. Borrero's contributions to literature and the implications of her work on the field of applied behavior analysis. Dr. Carrie S.W. Borrero is a decorated scholar in the field of behavior analysis. Dr. Borrero has held her doctorate degree from the University of Florida since 2006, as well as board certification and licensure from the Behavior Analysis Certification Board. Dr. Borrero currently works as an assistant professor at the Johns Hopkins University School of Medicine in the Department of Psychiatry and Behavioral Sciences, and as a senior behavior analyst at the Kennedy Krieger Institute, where she has worked in the Pediatric Feeding Disorders Program since 2007. Here you will see a few of the journal articles I selected to review to gain an understanding of Dr. Borrero's contribution to literature. A major element throughout her literature is pediatric food refusals, including the examination of extinction bursts, functions of inappropriate mealtime behaviors, and the use of physical prompting and treatment. Dr. Borrero is also well known in research regarding the relationship between individuals and their parents and caregivers, studying the effect of reprimands on future occurrences of behavior. Her research is inclusive of a range of individuals with developmental disabilities and other health concerns. Let's take a closer look at each of these studies and discuss their findings. In 2005, Dr. Borrero and her colleagues published descriptive analyses of caregiver reprimands. In this study, they sought to evaluate the correspondence between caregiver reprimands and how often the child engaged in targeted maladaptive behaviors after the reprimand. 5 child caregiver pairs were selected, and a descriptive analysis was conducted weekly for each participant where the data was collected on the frequency of maladaptive behaviors prior to and following caregiver reprimands. The study ultimately showed a temporary decrease in maladaptive behaviors following caregiver reprimands, suggesting that caregiver reprimanding may be negatively reinforced by the brief reduction in maladaptive behavior. However, we must also acknowledge the limitations of this study and not consider the results of the study alone when providing parent or caregiver training. In other words, the study does not show that reprimanding is an effective means of reducing problem behavior, but rather studies the dynamic of that relationship. In 2010, Dr. Borrero and colleagues published descriptive analyses of pediatric food refusal and acceptance. In this study, they sought to understand the function of inappropriate mealtime behaviors. 25 participants were selected and observed, as a descriptive analysis was conducted while caregivers fed their child. Data collectors noted frequencies of inappropriate mealtime behaviors for the children, including disruption, gagging or coughing, spitting out their food, vomiting, then problem behavior that was observed after forms of attention, tangibles, or escape. Let's take a closer look at the data shown on the top and bottom rows. The top row shows forms of attention, including coaxing, threatening, reprimanding, and concern or comfort, while the bottom row shows forms of escape, including spoon or cup removal, leaving the area, and meal termination. Upon probability analysis, it was determined that refusals are typically maintained by escape and attention. Dr. Borrero continues her work in describing how physical prompting is an effective procedure to implement when treating pediatric food refusals. Take note of our previous discussion that these refusals are typically maintained by escape, and consider how these procedures can aid in extinguishing escape. In 2013, Dr. Borrero and colleagues published a comparison of 2 physical guidance procedures in the treatment of pediatric food refusal. In this study, they sought to compare the effectiveness of 2 different physical prompts, the non-removal of the spoon and the jaw or finger prompt. 4 participants were selected, and trained observers noted how long it took the children to accept a bite of food, as well as inappropriate mealtime behaviors, prior to and after the implementation of physical prompting. On the left, we see the methodology of the jaw prompt, where the implementer places their hand, palm facing upward, under the chin of the individual. And on the right, we see the finger prompt, where the implementer takes their pointer finger and places it inside the individual's mouth between their cheek and gums. Ultimately, this study replicated other studies in showing that the use of the jaw prompt is an effective means of reducing bite latency and inappropriate mealtime behaviors. This study also demonstrated similar results for the use of the finger prompt. In 2016, Dr. Borrero and her colleagues published this study to determine the efficacy of descriptive and functional analyses, solely in application to inappropriate mealtime behaviors. Previous studies have suggested that the sole use of descriptive assessments lack efficacy in determining the function of behavior. Recall that descriptive assessments are a means of discovering the function of a behavior by directly observing the behavior, noting what precedes and follows the behavior. Both descriptive and functional analyses were conducted and analyzed for 10 participants, displaying a high correspondence between the two. So why is this important? Because descriptive assessments are a much more practitioner-friendly method and just as effective in the application of inappropriate mealtime behaviors. More recently, in 2019, Dr. Borrero and her colleague sought to examine the resulting extinction burst that can accompany the use of an escape extinction procedure when treating pediatric food refusals. Recall that an extinction burst is the brief increase in the frequency and/or intensity of the maladaptive behavior following the removal of reinforcement for a behavior that was previously reinforced. 10 participants were selected and evaluated several times a day over a 6 to 8 week period. Trained data collectors recorded occurrences of inappropriate mealtime behaviors as well as the duration of these behaviors. Ultimately, the study found that 30% of the participants showed an extinction burst. In the graph displayed on the screen, we can see an example of an extinction burst right here. Although the extinction burst persisted for some, they were short-lasting, thus explaining that escape extinction remains an effective procedure in treating pediatric food refusals. Typical escape extinction procedures involve disallowing the individual to leave the meal or not ending mealtime due to the individual engaging in maladaptive behavior. If given the opportunity to interview Dr. Borrero, I would be interested to gain a greater understanding of how she initially got involved with behavior analysis, what other fields within behavior analysis sparked her interest, what specifically drew her towards pediatric food refusals as a main focus of her research, what the most influential aspect of her educational and professional experience was, and what failures she's encountered as a behavior analyst and how those failures have helped shape her career path. As mentioned previously, Dr. Borrero's research is inclusive of a range of individuals with developmental disabilities, but the application of children with autism is instrumental in the field of applied behavior analysis. Due to children with autism's repetitive or ritualistic behaviors and typical insistence on sameness, food refusals are common among this population. Dr. Borrero's literature provides relevant information for other behavior analysts to access to increase their understanding of assessment and treatment of food refusals, as this can pose complex issues for the individuals with developmental disabilities, their families, and their treatment providers. Finally, I have listed the references utilized to create this presentation. Thank you for listening.